Hi everyone, Dr. Cliff Faver out here, and this week I want to express some frustration that I have on a regular basis, and that's with having a veterinarian that maybe is not doing their job. Now, veterinarians are no different than any other profession. There's a lot of groomers out there that don't do their job. There's a lot of bathers that don't do their job. There's a lot of doctors that don't do their job. But I just want to discuss one of the things that we run into on a regular basis when we're consulting. And that's where a veterinarian, whether it be from ego, lack of knowledge, too busy, who knows, has made a quick decision without solving a problem. And part of the reason I want you to do this is we need to have the mindset is if we go to a professional, they're there to help us solve the problem. If they're not helping us solve the problem, then maybe we've hired the wrong professional. Could you imagine you go to a lawyer because you had a car wreck and you're getting sued, and he said, yep, it just thinks you had a car wreck and does nothing. What's the difference of that than going to a veterinarian and says, oh yeah, the eyes are gooey and or the feet are inflamed. It's just allergies. You're just going to have to live with it. That's not a good answer. We need to have some type of resolution. We need to have some type of plan on that. I've had a couple of cases recently. I had one that had a real bad eye problem. Actually, I've had two just recently, had real bad eye problems, ooey gooey nasties there. The veterinarian said, oh, that's just allergies, no big deal. Gave him a shot of, or gave him some Apoquil and called it a day. If it's ooey gooey and got green stuff, we got an infection. We need to deal with that. Now, that's a symptom. I agree with them on that, is that's a symptom, but we also have to address the problem. Because if we don't address the problem, it's going to continue to get worse. It's going to continue to be an issue with the animal. And a lot of times it's very, very painful on that. So especially, and I'm going to say one of my pet peeves is definitely a diagnosis of allergies, because we lump a whole bunch of things in there and sometimes we don't look any further than that. I'm going to tell you a lot of allergies, number one, are just dry skin. They're not truly allergies, and that's not even on the rule out list a lot of times with the veterinarians. We also have ones that have something like an autoimmune disease. We have sebaceous adenitis. We have, all these different conditions that the veterinarians don't even address or even attempt to address. Doing a skin biopsy to differentiate between allergies or sebaceous adenitis is something very simple. Why would a veterinarian refuse to do that? Why? I question that. If a client come to me and said, hey, I want a skin biopsy, and I know it's not going to hurt the animal, it's a simple procedure. It's like, sure. If it comes out negative, great. Now we've got some good information on that. We've ruled out some things. But what if it comes out positive? What if we don't truly have allergies? What if we have sebaceous adenitis and we've been treating it all wrong through the whole thing? Now that's a game changer. And that's where a lot of times, going to specialists become important. And, I know it's always hard from a groomer aspect as when do you, if you have a veterinarian in the area that's not doing the job, how do you handle it? Now I'm going to tell you, and this is coming from me, practice veterinarian. I like to think I'm pretty smart. So if I'm missing it and you send it to somebody down the street that's on an equal level to me, I'm going to be offended. Right, wrong, or otherwise, I'm going to be offended. But if you send it to a specialist, I'm going to have to say, okay, he or she has more letters behind their name. They've got more experience than I do. And so therefore I have to respect that. I hope you understand that. So wherever you can, instead of going laterally, even though you know that Dr. Smith down the block is the smartest on the block, be very cautious, because you may need Dr. George over here to be a referral source. A lot of your clients may go to them. You don't want to create a problem there. So whenever possible, send them to a specialist. And hopefully you're going to get more information. Now, having said that, I'm very disappointed with some of our specialists too, because sometimes they continue to do the same thing that didn't work with the routine veterinarian. But at least you're keeping peace in the family. At least you're having another set of eyes look at it, and hopefully you can get some answer there. So just a little vent there, when in doubt, if we're not getting the answers we have, number one, we're here to help you with a lot of those. And there's going to be a time and place that Suzanne or Heather or Tish or I look at that and say, you really need to get more information. And when we do that, then hopefully we can help you get to the right places on that, so that we make sure that we're treating from a level of knowledge versus guesses. Because just like a lot of times, whether it be groomers or veterinarians, we're working with a guess, and a guess is not doesn't get good results on that. So hopefully that helps. We will see you next week. Thanks a lot. Goodbye.